Hi, I'm Dr. Vashisht Dikshit. I'm a plastic surgeon here in Mumbai, India. The terminology behind facelifts often gets confusing. What exactly is a mini facelift, what is a smash-only lift, and what is a deep plane facelift? Addition to this, people usually combine procedures and maybe, add some new name to it, which further adds to the confusion. Keep it simple, a mini facelift is usually only a skin-only lift. The incisions are far more targeted and they can be placed depending on which area needs more lifting. Maybe a mid facelift will have a slightly higher place scar. A lower facelift can have a scar that is slightly lower. A smash lift is a skin plus a smash lift. The smash is the underlying fat and the muscular layer, the supportive layer of the skin. A deep plane facelift is an evolution, which is the latest that is performed nowadays, in which the smash layer is also lifted separately, and this really allows us to customize the vectors or the directions in which we are able to lift and manipulate tissues. So this is just a brief difference between these three procedures in increasing order of complexity and technicality. So it would be mini lifts, which includes a ponytail lift as well, followed by a smash lift, and finally the deep plane facelift. A mini facelift would make sense for someone who is slightly more younger, as the results aren't as dramatic as a more extensive or a more invasive procedure. A mini facelift would be perfect for those who are beginning to show signs of aging, beginning to have a little bit descent of tissues, beginning to see the nasolabial folds getting slightly deeper. Whereas a more extensive facelift, including a deep plane facelift, would be well suited for those who are having more of sagging skin and neck skin, or possibly those who are slightly older. So these would be better candidates for a more extensive smash or a deep plane facelift. The scars are something that often concern the patients. However, the techniques that we do follow in plastic surgery ensure that the scars are very well hidden. Additionally, scars on the face typically tend to heal much better compared to scars elsewhere on the body, thanks to robust blood supply of the face. We place the scars right in front of the ears. They typically extend from right above the ear into the hairline, along the front border of the ear, and they turn behind the ear lobule. For a mini facelift, a scar would be just limited to in front of the ear, whereas for a deeper lift or a smash lift, we would extend the scar up from the temporal region right across the hairline, along the front border of the ear, as I had mentioned earlier, turning around the ear and back into the neck. Whether a patient requires a smash lift or a deep plane lift depends entirely on the patient's goals and the patient's present situation. Typically, for those who have more thicker skin and those who have more elasticity in the skin still, a smash lift can give the best kind of results. However, for those whose skin isn't as strong, the skin is a little weak, we do prefer to proceed with a deep plane facelift, as we do need the extra support from the smash layer as well. One thing to note is both the smash lift and the deep plane facelift are going to address the smash layer. Just the difference in technique is that in a deep plane facelift, scars are custom tailored for the lift that you require. So it's very difficult for me to tell you how exactly long a scar is going to be unless I have a good discussion with you regarding what your goals are. The smash layer is also elevated, and we do divide the retaining ligaments of the face. Retaining ligaments of the face in those patients who have real laxity of the retaining ligaments, causing a lot of, say, jowling or skin laxity. In those patients, we would prefer deep plane approach. In those who have the retaining ligaments, they are not as stretched, we would consider a smash lift only. Results of a facelift last as long as they are maintained. We have to understand that we are fighting time, and no one really wins against time. That being said, a well-performed facelift, a well-timed facelift will last for, say, around 10 to 20 years. What we're trying to do is just turn back the clock. We are not able to completely stop the aging process. However, we usually do see is a facelift can, maybe turn back the clock by around 10 or 20 years. That's what we typically aim to perform. Following this, if the results are maintained, if you maintain a good skincare regimen, get treatments on time, you can expect your results to last for maybe around 20 odd years. On average, the surgical duration, again, it does depend on the surgeon as well. Typically, my facelifts, if I'm doing a mini lift, it would last about 3 hours or so. However, a more extensive lift, something like a smash lift or a deep plane facelift, can last up to 4 or 5 hours. Post-operative care is almost as important, if not more important, than the surgery itself. Primarily because the post-operative healing period is when we can manipulate tissues even further. So in terms of post-operative care, it includes basic things like taking a good healthy diet, staying hydrated, using your sunscreen. We do also teach you a lymphatic massage and a scar massage in order to take care of the scar itself, to ensure that it is as least visible and as least conspicuous as possible. Beyond this, you will need to apply and wear your compression garment for about 4 weeks. This allows the skin to drape along the new structure that we have created much better. So if a facelift has been performed, we usually would like maybe a gap of 3 to 6 months to allow tissues to heal sufficiently well in the location that they have been placed. The reason being, we do see an evolution of your result. So you would always want a stable foundation to build upon. So if we are going to do another procedure on the face, we'd like everything to settle down, which usually takes about 3 to 6 months. So 3 to 6 months is a good gap to keep between a facelift and any other facial procedure, say like a hair transplant.